Good morning. I'm Dr. Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. All right, now since the start of the COVID pandemic, and yes, we still do talk about COVID, tens of millions of people around the world have recovered from an acute COVID infection, only to face additional symptoms that can linger for months or years. We call that long COVID. That name came about during the middle of the pandemic. It's a simple name, but it's a very complex medical condition that can present differently depending on the patient. Today, we're checking on the status of some long COVID research and hearing a little from someone who is using his own long COVID experience to connect with others. Joining me in the studio today is Dr. Mario Castro. Now, Mario's been on our program before. He is a Vice Chair for Clinical and Translational Research at the University of Kansas Medical Center, the Division Chief of Pulmonary Critical Care Medicine, Sleep Medicine here at the Health System, one of my many bosses, a good friend. Dr. Castro, my sir, welcome back.
Thank you, Dr. Stites.
Always a pleasure.
You got a few more titles as well now.
Yeah, that's a little troublesome, actually. Yeah, I thought I was retiring, but that didn't happen. All right, also here is Jill Von Fange. I almost said it wrong. I rehearsed this. I rehearsed this. I was trying to turn this into something very cool, and she told me to stop. And so she is the program manager at Turning Point. Turning Point is great. Well, providers like myself focus on medical needs. Turning Point helps patients and their families with emotional, social, and psychological needs through support groups, classes, activities, and more. Thank you for being here.
Thank you for having me.
We love the work that Turning Point has done.
You
guys are a big part of our program here throughout COVID, and some of your team was here, and that was awesome. All right, Turning Point recently hosted an award-winning cellist who is also living with long COVID. He was on this program once before and played for us just for a moment. Joshua Roman's album, Immunity, was inspired by the severe impacts long COVID has had on his life. Let's hear a little from Joshua. Here's Janine Kiesling.
Cellist Joshua Roman doesn't remember a life without a cello in his hands.
I was handed a cello when I was 3, and I loved it. And by the time I was 6, I knew, and I was telling everyone that this is what I want to do with my life.
By 16, Joshua was off to college, the Cleveland Institute of Music, destined for a bright future in music. But in January 2021, at just 37 years old, everything changed.
My acute COVID experience was mostly shortness of breath, funny things with my heart, my cognitive abilities were very inhibited, and a lot of fatigue.
At 10 days after his COVID diagnosis, Joshua knew he was in trouble. He didn't know then, but eventually it was clear. Joshua was a long hauler.
I was really struggling to be active at all. Washing the dishes was very hard. Walking upstairs was very hard. I sometimes would have to crawl up, and it would take a long time just to do 8 stairs.
For the first time since he was a toddler, Joshua put the cello down and contemplated quitting.
At that moment, it was so hard for me to play at all that the idea of giving that up and moving on to something more practical.
But Joshua found renewed purpose when a friend invited him to play at a summer solstice party.
When I felt the cello again, what overcame me was that feeling of connection and love.
When a friend at Princeton invited Joshua to join a concert series aimed at healing through music for those facing health crises, Joshua knew this is what he needed. Now he plays concerts like this at the Cancer Center in Olathe, drawing attention to the Turning Point Long COVID Support Group.
It was so powerful that I felt that I didn't even have to play. You can still be alive even more than you were before. You can engage with the world in powerful ways and have a very fulfilling life.
Now his message, even more than his music, is making an impact on his audiences everywhere.
The strengths of Turning Point is they offer programs that really speak to sort of the holistic process of healing for patients.
Just to hear how he's gone through his journey and kind of the message that he took away from that of not just acceptance, but embracing the change and how we are now, I think is a good message to go away with.
Joshua was traveling this morning and couldn't make it for this live stream, but here's him describing some of long COVID's impacts on him when I interviewed him last year on this program.
With long COVID came dysautonomia, processing difficulties, so cognitive issues that stopped me from going to grocery stores, driving, even reading sometimes. And now, instead of running the mile in under 6 minutes, I have trouble walking up the stairs in the subway in New York City, and often have to pause. So it has dramatically changed my ability to consider myself an independent person. And ultimately, I think there's a good lesson in there, which is we all need help, and embracing our vulnerability is important as human beings, helps us connect. But it has stopped me from doing a lot of the things that I used to consider very much a part of my identity.
Hey, Dr. Castro, do you think it's possible that I could blame my cognitive abilities, my wife's faults, on long COVID? You think that would work? And no, they may have pre-existed.
I was going to say, did you run the mile under 6 minutes?
Oh gosh, yes. Yeah, when no. Joshua also explained that his long COVID symptoms seemed to change every time he got a new active COVID infection. He almost gave up the cello, but says he can still perform as long as he paces himself in the hours leading up to the show. Jill, thank you for helping bring Joshua here to the health system for that performance. That was awesome. Mm-hmm. From your perspective, how do events like that help people that live with chronic conditions, whether it's long COVID or something different?
Okay, thank you. So it helps people not feel alone. They feel like a shared experience, helps them create a space for sharing struggles, setbacks, but also victories. And so not only are people sharing, what's gone well, but maybe what hasn't gone well, but they don't feel alone. And so often when we talk to people that have a chronic illness, when they meet someone that has something similar or the same, they're like, oh, I'm not the only one. And so again, just that feeling of like, oh, it's not just me. Or for a lot of people with long COVID, we heard people say, oh, I'm not crazy, especially early on, because so many of their family and friends were like, what is going on? They didn't understand what do you mean long COVID? What is this? Their families couldn't understand why they didn't just get over the initial infection and be okay. And so for so many people, they when they met someone else or heard from someone else, they're like, oh, I'm not crazy. This is happening to someone else. And then what Joshua shows is that people can adapt and adjust to do what they love. And even though it may not be the same, it could be something similar. And that what once was could be again. And so that provides hope and instills hope. And so I think what Joshua showed was that he adapted some of the things that he does so that he could still do what he loves. And so I think that instilled a lot of hope. And this program will show people that have other chronic illnesses that maybe what once was can be again. It may just be a little bit different. So
hope is one of the most powerful of all therapies in medicine, and I've practiced in the area of cystic fibrosis and end-stage lung disease for many years, and it's where you find hope, and sometimes hope is having a comfortable death, but where you find hope is incredibly important to a patient. I'm not sure we ever talk about it enough, and I so appreciate that you've mentioned it. We've talked about Turning Point on this program before, but for those unfamiliar, help explain what kind of things you offer and what Turning Point does.
Well, we offer in March and April, just give you an example of the breadth of what we offer. In March and April, we have over 370 different offerings in those, 62 days? I don't know the math right now, but so there's something for everyone. Some important things to remember about Turning Point is that we provide support for people impacted by a serious or chronic physical illness. And so we not only support the person that has the illness, whether it be Parkinson's, long COVID, autoimmune disease, heart disease, diabetes, you name any physical illness, We also support the caregivers and the family that's impacted by that illness. So I always like to remind people that sometimes it may not be the person with the actual illness that is going to, contact Turning Point. It might be the caregiver or the supporter, and that's okay. So oftentimes people that might have, like, I'll give you an example. I help co-lead a Parkinson's support group. And in that support group, half of the people have Parkinson's, and the other half of the people in the group are care partners, as we like to call in Parkinson's world. And the people with Parkinson's don't want to do some stuff at Turning Point, but the care partners need to fill up their emotional bucket, if you will. And so they come to Turning Point via Zoom, mostly, some in person. A couple key things with Turning Point would be that almost all of our stuff is on Zoom. So if you're tuning into this and you live in Colby, Kansas, you live in Denver, Colorado, you live in Lenexa, Lee Summit, you can Zoom in to so many of our programs and classes. And the other important thing is that it's at no cost. We don't take insurance. I don't want to know any insurance information. And that you do not have to be a patient here at the University of Kansas Health System. You can be a patient anywhere. You can be, again, in Michigan, Denver, Colorado. My parents are currently in Arkansas, and they've tuned in. And so there's lots of different programs and classes and support groups to help people that are impacted by illness. We also help kids that are impacted by their own illness, or if their parent is battling something that the parents are thinking, oh my gosh, how do we tell our 5, 6, 7, 8, 9, or 10-year-old what cancer is? Or what is this going to mean for the family going forward? We support families and parents in helping guide them and helping support their children. And then we also work with kids through play, art, music, books, to help explain an illness that the child may have or that their parent has. And so pretty comprehensive.
Senator Castro, long COVID. Oh, first of all, thank you.
You're
And
welcome.
I love the work Turning
No,
Point does, and
thanks.
sending number of patients down there. You do great work. Senator Castro, long COVID can include a lot of different symptoms, and I think there's 200 plus possible associated with symptoms. So talk to us what the dominant symptoms are around, like, fatigue or neurocognitive issues. The things I could blame, I tell my wife it's from my COVID stuff. Yeah, maybe.
Well, thank goodness we have narrowed down that list from 200 down to about 11 key symptoms that are part of the definition of long COVID. And as Jill mentioned, this is a chronic disease that seriously impacts patients' lives. We've narrowed it down to about 11 key symptoms. They're a combination of fatigue, a little bit that we heard about from Joshua, post-exertional malaise, or after you exercise, really are disproportionately affected in terms of that exercise, changes in your sense of smell, taste, things like palpitations, feeling your heart racing, lightheadedness, things that are also shortness of breath, things that we deal with all the time as pulmonologists, shortness of breath and chest tightness that is associated with that. And then interestingly, also sleep disorders. And there's been now some interesting work in terms of looking at how long COVID has impacted patients, disrupted their sleep, and also lead to conditions that we commonly treat like sleep apnea.
So do we have a true grasp of how many people are dealing with long COVID out there? Because I don't know, the symptoms are just amorphous enough that people may not really kind of make the connection.
Yeah, it's a great question, and I think, as you said, during the pandemic, we're learning as we're
Flying the plane.
Flying
We'll
the
it like we fly it. That's it,
Yeah,
right there.
and we're still doing that with long COVID. We are now thinking about long COVID as a condition of many different disorders, and we have now narrowed it down to about 5 different clusters of symptoms that we call. And when you have a complex disease like this, the way you attack it is you narrow down what's affecting that patient, and then you tackle that problem. You can't tackle all 200 symptoms, like you said, but if you can narrow it down to what's their primary problem, then you can start developing treatments that are specific to that.
So you are, so we talked a little bit about the theories that cause long COVID. Let's talk about your involvement in the KUMC Recover research trial. Now, you've been working on a series of long COVID treatment trials that we've talked about here on the program before, but we are limited on what we can say about research that's still underway. But can you tell us about these different treatment trials and how the new theories of what causes long COVID in these trials are linked together?
Yeah, and what's amazing about COVID is that, we were dealing with this pandemic not so long ago, and now we're coming up with treatments for a chronic condition related to that pandemic. And I think it's just lightning speed. Having been in development of a lot of different medications, we know the pipeline often is 10 to 15 years to develop something like that. And so to be here 4 to 5 years and launched already some trials in long COVID is really groundbreaking. And so we've launched 5 trials here. The first one, Recover Vital, was really trying to tackle this problem about the virus persisting. And we've learned that the virus can persist in your body in different pockets that may not be easily detectable. There has now been developed a test where we can look at viral particles, and Dr. Hawkinson can talk about how we've done that in other viral diseases, and that's really helped us advance the field because you can measure what that burden is. We have also, and we've completed enrollment for that Recover Vital trial. We're now waiting for the results of that trial, and we're hoping now with this infrastructure that new treatments can be launched quicker because we now have the infrastructure, we have patients that are interested in participating. We also had Recover Neuro. Recover Neuro was really focusing on those symptoms that Joshua was talking about, that brain fog. It's a great name because I think it so aptly describes what happens with patients with long COVID. We also have a new trial that we've partnered with Dr. Jakazik here at the health system to launch, which is called Recover Energize. And I'm really excited about this trial because often what I hear from my long COVID patients is, I can't do what I was doing before. I can't do the 6-minute mile. Some very high-performing individuals now are really decimated in terms of their ability to exercise. And Recover Energize is taking 2 different ways of looking at how do you train somebody, how do you work with somebody. It's not the usual go to the gym and work out for 30 minutes. It's a different mechanism of how you train somebody to recover from that, and so I'm excited about that. We also have Recover Sleep. Recover Sleep is using different treatments for helping patients with persistent sleepiness throughout the day, this fatigue and so on, and looking at different medications as well as different treatments for their sleep apnea. And we're excited about that. And then the last one is Recover Autonomic, which I think Joshua also mentioned, dysautonomia, fancy medical term. That term just really means that for some reason this virus, very unusual, attacked the nervous system that controls the heart, the brain, and how those things work together. So when I wake up in the morning and get out of bed, there's a reason why I don't faint. But patients with dysautonomia, actually that happens to them. They get lightheaded. It's hard for them to even get out of bed. And so we're now studying some treatments that may allow them to resume a more normal life. So it's exciting, really, therapy that I'm really just glad that we're here at the forefront to offer that for our patients.
You mentioned there's some emails up here that Recover Sleep, Energize, and Autonomic have. Talk to us about what those emails are for.
Yeah, so these are emails to contact the lead study coordinators for these studies. As we mentioned, Recover Vital, Recover Neuro has completed their enrollment, but we're kind of staying tuned because we're available for new treatments. So reach out to those emails if you are have some interest in pursuing that long COVID trial. We would love to screen you over the phone, kind of see if this is something that would be good for you and let you make a decision. One thing I always say is the only way, Steve, that we can get in front of these diseases is by doing the research.
100%. And if we don't do that research, the diseases stay way out in front of us, and that's not what we want to see. So, Mara, here's one question that, as I look at this and I think about some of the other viruses that are out there, it feels like some of these other viruses can kind of do some of these same things. You think about some of these really bad ones, like an adenovirus, metapneumovirus, blah, blah, blah. People get sort of that long post-viral thing or that chronic fatigue. Is there a correlation here?
Yeah, in fact, I think a lot of our science about long COVID is advancing because we've studied other diseases like Epstein-Barr virus, EBV, HTLV. These viruses have this predilection to stick around in the system for years. And what we've learned is that some of those can cause things like chronic fatigue syndrome, but also others can cause malignancies. Lymphoproliferative disorders are, a type of cancer. And so we know that these viruses are important to study because that's the only way that we can get effective treatments to try to prevent these diseases.
But without the actual science, you won't find the answer.
Exactly.
People can say, well, we'll try this, try that, and they throw stuff out there like it's snake oil. It's like this 1800s again. But the reality is, with science, we find answers, and otherwise, all you do is you just flounder. And I don't want to be a flounder. So how do people find you about things like this?
Yeah, so Turning Point, I think we're going to pull that up, but our website is turningpointkc.org. We are part of the University of Kansas Health System, so if you go into probably like the health system website and maybe do the search Turning Point, you hopefully should be able to find us. Other support that's outside of Turning Point would be that there is a virtual support group out of the Seattle area for people with long COVID. So if you're looking for a specific support group, emotional support group for long COVID, there is one out of Seattle, and you can contact us and I can help guide you to that. There are some private Facebook groups that people have found helpful if they have long COVID, because sometimes in the middle of the night at 2 a.m., that's when you're waking up and you need support, and you can go to those pages and you can find it, through people's, statements or comments or posting your own. There's a chronic disease management curriculum that's offered sometimes through Turning Point, sometimes here through the Landon Center. And that's a great curriculum and support for people impacted by a chronic illness such as long COVID. And then individual therapy. I think we should always encourage people that, if they're looking for support that needs to be a little bit more intense in nature, I think an individual therapy is always a good practice.
Yeah.
And again, they can reach out to Turning Point, and myself and Lizzie Ryder, other social worker at Turning Point, can help guide people to something that may not be at Turning Point, but that may be out in the community here or where they live.
That is so important, and I really do love the work that y'all do.
Thank you.
We are here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. All right. 3 things. It says 2 on my screen, but we're going to go with 3 because I want you to talk a little bit about long COVID as well and some of the things you've been seeing in your world. Yeah. But first of all, flu season is winding down. Those measles cases are concerning. All right, so first, flu season looking better.
Yeah, the easy thing about flu season, just like you said, it is winding down. We have excellent data from the United States in general, but also specifically here at our hospital. We have had a significant decrease the last 4 weeks of admissions for influenza. Unfortunately, we still have a little bit of RSV and COVID admissions, which seem to be stable. I was hoping the COVID admissions would go down. You can see that there on the graph. The blue line, which has that steep curve down, that is influenza. We've seen those decreased admissions. And then the green and the orange is RSV and COVID. Still that little low level. Overall, we are exiting out of respiratory viral season. We know COVID, our SARS-CoV-2, is seasonal in the fact that it can occur or have spikes in any season that it would like. So we are waiting to see if in the next couple months there will be a resurgence of that. Hopefully not, but I think we have to expect it until we don't start to see that. So.
Yeah, I hope you're right. Let's watch that path continue to drop because I do like the descending curve.
Yes.
Okay, now on to measles. Yeah. We know there was 1 confirmed case in southwestern Kansas. We don't have a lot of details about that. Larger outbreaks, Texas, New Mexico, almost entirely in unvaccinated people. We've been getting questions from folks wondering if they need to go out and get a measles vaccine.
Yeah. we do have a little bit of an infographic and talking about who needs to get it. Really, if you're born before 1957, you are considered immune.
Because you had it.
What's that?
Because you likely had it.
Because you likely had it. It was spread throughout the communities to a great extent, along with other vaccine preventable diseases as well. So you are immune at that point. There is a little bit of gray area just because the vaccine was a little bit different if you were vaccinated before 1968. It is hard to know and understand. Best to talk with your doctor about it. But you are otherwise considered immune if you have a documented 2 doses of MMR vaccine. And then if you don't, do you have any evidence of 1 dose of vaccine? You need to speak with your medical provider. Certainly there is the ability to test for antibodies to that, but sometimes there can be false negatives. Certainly it is always okay if you are unsure to get the vaccine dose now. It has a great track record of being very safe and very effective. We should understand though that there is a cost to that, and what I mean by that is a cost about vaccine shortage. Currently we are doing okay here. However, I think down in West Texas in that area they may have seen some shortage just because the demand is so high. So just be aware of that.
So if you've been vaccinated since 1968, you should be in pretty good shape?
Yes, if you've had 2 doses, you would be considered immune at this point in time. Yep.
What happens if you had an MMR and you've had measles when you were born in 1960 and you may have had measles? That's what my mom told me.
Yeah, if you had measles, then you would be considered immune. You'd have that natural infection immunity, which is not better because we know and understand the consequences that could occur if you actually get the disease. Remember, about 1 in 5 people are hospitalized. 1 in 20 will get pneumonia. 1 to 3 can get the encephalitis or the brain infection. And then about 1 in 1,000 die. Unfortunately, with our current outbreak in Texas and New Mexico, we've already seen 2 people perish. We've also seen a hospitalization rate of about 12%. It is lower than overall statistics, but we have to wait to see everything plays out. In addition, why would you even roll the dice and take the chance of having an illness to go to the hospital? So I think the best thing is really, and again, we have a great 50, 60 years track record of this vaccine, is getting the vaccine, being immune, protecting yourself and your family.
Yeah, I just want to say it's been a really long time that vaccine's been around, and just like all vaccines, it is incredible.
Yeah.
The vaccines we use today, they're all incredibly safe.
Absolutely.
And I think we have to acknowledge the science that's been around this for a long time, and the proof of what happens when you don't take measles or you don't get the vaccination. A disease that we haven't seen in years all of a sudden pops right up because people weren't vaccinated and they were thinking that vitamin A was going to save them, and obviously that was not the case. Hey, one question. We were talking about this long COVID thing before. What's your sense about long COVID? I mean, I should have asked you a few things around it. Well, give us your insight.
I'm certainly focused on why do we have it, and again, there have been multiple mechanisms. Is there some immune privileged site where you still have some antigen production or some replication of the virus, creating that continued inflammatory process? Then you have release of the chemicals in your body causing these things. Is it due to also other maybe micro blood clots causing symptoms, again because of continued antigen in your body, continued inflammation in your body? So I think really I'm focused on why is this happening, what can we do to alleviate that, and then also what can we do to find specific therapies for whatever specific problems patients may have. We know that it is a significant quality of life impactor daily for a lot of people around our nation. It continues to be. But we also have good evidence. We were talking about vaccines. There's a recent study out that I was just looking at. Getting a couple doses of vaccine really does help, or did help, lower somebody's risk for getting long COVID as well. So there are just many factors that interplay. I think the biggest one is that we do have to acknowledge, you do have to understand that it does affect people's quality of life on a daily basis for many people around our country, and we need to continue the research to find the etiology of that, but also maybe general or specific therapies for those problems.
Thank you, sir. Appreciate it. And one last question. Does vaccination make it better? We've talked about that early on in this program. Hey, vaccine may actually make long COVID better. A, does it lower the risk of it? And B, does it make it better? I open that up to both of you.
Yeah, so in the RECOVER study, which has over 14,000 patients nationwide,
That's a few, yeah.
that's just a few, we found that the incidence in that cohort of long COVID was up to 20%. And if you got vaccinated, that rate dropped dramatically, less than 50% of that. So the vaccine does help you prevent ever having long COVID. And even in those patients, they tend to be less serious long COVID infections and long COVID impact.
So once again, get vaccinated.
Yep.
All right. We know many of you have questions. Let's head to Studio B. Wait a minute. Wait for it. It's Jill Chadwick. This is like the Back to the Future, Jill. I love that you're on the program this morning.
Thank you and hello. It's really fun to be here. First, I want to tell you that we did drop the link to Turning Point and to the emails that Dr. Castro referenced if you want to see if you're eligible for one of the studies. Ruth Ellen has our first comment today. She says, thank you for the work on today's program. And her question is for Dr. Castro. She's curious about the funding for your research.
Oh, that's a good and explosive question, but we're nervous.
The National Institutes of Health is funding our research here at University of Kansas. And it is something that Congress appropriated money for specifically to help us address this pandemic and the health consequences of long COVID.
All right.
But we need continued funding. That's the.
What we could say very simply to our audience, Jill, is that no funding, no science, no cures. I mean, it's very simple. These things don't come out of the blue. They come because of years of work by dedicated people. And it's not like the people who work in research and universities are out there getting rich. This is not a get-rich-quick scheme for anyone. Does there need to be some reform in the NIH? Sure. But that's nibbling around the edge. If you look at how the United States absolutely leads the world in developing new therapies for disease, then you have to look at what we've done with the NIH. It is a true success story, and despite what others may try to do to tear it down, it hurts our heart because here's what you can count on. You get one of these chronic diseases we don't have a therapy for, and you stop the NIH. You know, we talk about the intersection of faith, hope, and science. Man, you just gutted the hope side of that because you can't have science. Without science, there's not a cure.
So bottom line, go ahead and sign up if you're interested right now because we're still good to go.
That's correct. We're looking for new cures here for it. So please volunteer if you have the time and availability.
Yeah, well, pressing forward. So Jason Cohen, he emailed us and he has two questions. The first one has to do with he sees a lot of people, public figures out, and they're in big crowds, and he never hears about them getting COVID. So he's curious. I know you don't have a crystal ball, but could it be because he's been vaccinated or because of herd immunity?
Who was out in the?
Jason says he sees on TV all these public officials out in big crowds. They're shaking hands, they're talking, maybe even people at a local level, but he never hears about them getting COVID. I don't know that we would, but he's just wondering if that's vaccines or herd immunity at work.
I think that is a good question with a lot in there. So first I would say, yes, certainly private health information. I mean, most people are not out on TikTok or Instagram saying that they got COVID or influenza or measles or anything like that. Certainly some people, but I think a lot of people, the vast majority probably are not announcing their illnesses to the world. So I think that's it. And what about vaccines? Is he not getting the disease, as you said? I think we need to, and this is one thing that kind of bore out of the pandemic, we need to learn and understand about our messaging about vaccines. So number one, vaccines do not really protect you from getting infected. Certainly we saw that as a slight consequence to the vaccine for COVID-19 for a very small amount of time, for maybe 4 weeks. There is a little bit of protection against infection, but vaccines are really made to protect you from the complications of the disease, especially severe disease. So I would assume most all of these public figures are vaccinated, but they, just as they are not announcing if they get ill, they're probably not announcing if they get vaccinated either. We know a lot of division goes along with that. So we have to be aware of that as well. And so I would just say that, you know, again, They could be getting it. We don't know. They probably aren't announcing it. Are they vaccinated? I would say more than likely many of them are vaccinated. And again, the vaccine is not to protect against infection. The vaccines are to protect against the consequences of the disease, especially those severe consequences. And I'll let Dr. Stites and Dr. Castro answer anything else.
Yeah, I'm right there with you.
I would say that I've heard some patients might say, oh, I had COVID, I should be protected, right?
Yeah.
And so I do think there's an important message that if you had COVID, that's great, because we do know that natural infection does boost your immunity. But if you get vaccinated on top of that, then you get really protected. We know that combination of the vaccine with natural infection is even more protective. As Dr. Hawkeye mentioned, it's decreasing that risk of the serious episodes that land you in the hospital.
And the good news is that all things are true here in terms of either vaccine or having COVID yourself will help you protect you. And the other thing I just say is our disease prevalence is relatively low right now, and so you're less likely to get it. But the disease prevalence was very high of influenza, and I think you can see that still was very prevalent even a few weeks ago. It's beginning to slow down now, fortunately.
Yeah, and I would say, is there a way to protect from infection? Absolutely. You hear Dr. Stites talk about it all the time. If you can frequently do adequate hand hygiene, soap and water, alcohol-based hand sanitizers, avoid putting your hands in your eyes, your nose, your mouth. That is going to be the best thing to help protect you getting infected from a lot of these respiratory viruses, not necessarily measles, as that is really purely airborne, essentially. So I think that is important to understand as well. But that would probably be the only thing protecting against infection. So.
What about masking?
Masking can help. Masking has shown for a lot of diseases to help even those who are wearing a mask, if they are in a presence of people who aren't. That can also help reduce your chance of infection as well.
You mean those rules of infection prevention and control keep you safe wherever you go.
Absolutely.
We may have said that 1 or 1,000,000 times, Jill.
This is true. I will tell you, I recently flew, and I always get sick whenever I get on an airplane. I get somebody's cold or whatever. I decided to wear a mask because I recently had a grandbaby, and I didn't want to make my little newborn grandson sick. So I wore a mask, and I didn't get sick this time. So I'm just saying. Shocker.
It works. Science works. Who knew?
Yeah, and I sat next to some other people who were wearing masks, so we all agreed. So, Jason's second question is one that I've always had too. Let's say that you're asymptomatic and you get COVID, or you have mild symptoms. Does that ever result in long COVID?
Yeah, unfortunately, we have had cases of long COVID that never had the symptomatic illness from COVID, but had evidence of viral particles when we analyzed the blood, and had evidence that they built immunity to the infection. So they were exposed, asymptomatic illness, but yet developed long COVID.
Cindy wants to know, do different variants of COVID carry different risks of long COVID? So now we're talking about, we know we've had a lot of mutations. Is there any evidence to know that some were more predestined to result in long COVID?
Yeah, so we've been studying what's evolved over the last 5 years in terms of the various variants, and it's thankfully the risk of long COVID has gone down with the more recent variants. It's nowhere near the levels that we saw initially with the pandemic.
Okay, and a question from Jean for Dr. Hawkinson. What do you do if you don't think you've had the measles, you don't think you've been vaccinated, and you were born before 1957? Should he go get a shot?
Again, per CDC recommendations, if you were born before 1957, you really are considered immune. Certainly you can talk with your doctor. If you would like, you can get a measles serology looking at antibody levels. Sometimes there can be false negatives on those tests. I think the best thing is to talk to your physician. And certainly if that decision comes that you should get a dose of MMR, again, it is going to be extremely safe and extremely effective. But I think in this case, the CDC recommendation is that if you were born before 1957, you really are considered immune. So I would start at that point, yeah.
Okay, and I would just say our final two questions I think we've kind of addressed, but they're just talking and asking about, because long COVID is so broad, does it make it difficult to distinguish when you have long COVID? And I think we've kind of talked about that, but there we go. It's been fun.
Yeah, that's been great. I have a question for Jill, though. Jill, there's a lot. These are challenging times, right? A little chaotic. Are you seeing more patients come to you, or more people come to you for help with just the changing, just the times we live in?
There's always, when you have an illness or you're, receive a new diagnosis, there's a lot of fear and uncertainty that goes along with that. But then I would say with, the recent climate and changes, possible changes in people's lives impacted on a larger scale, yes, that just adds to
exactly.
It just adds an additional fear and uncertainty that people are already experiencing, and so it just really magnifies a lot of what people are going through. So yes, for sure, we're here for people in these times and for the next while. So yes, we are seeing more people coming in concerned about their family, their jobs, their insurance, research, obviously, and the impact that it could have on their health care. And so, yes, fear and uncertainty just gets magnified.
Hope is important. Uncertainty makes it harder. Final questions, or final thoughts here as we end this program today. I'm going to start, actually, Jill, I'm going to start with you.
Oh, final thoughts. Oh, goodness. Well, I'm so thankful to have you all look at long COVID again. I know that the people that we've reached out to that have long COVID, they don't want to be forgotten. And so having this program and highlighting the research and the support is very important to anyone impacted by long COVID or any chronic and serious illness. So thank you.
Thank you, and thanks for the great work the Turning Point does. Dr. Castro, final thoughts.
Well, I think now more than ever, we need people to volunteer for these studies, because that's the way we get in front of it. So those emails, if we can show those one last time, those are the contact points to help us get on top of this. And if you have some time, participate, because that's the way you're going to be able to contribute.
Thank you. Doc Hawk.
Yeah, I think this was a great show. Again, we know long COVID does affect the quality of life of many, many people around our nation and even in our own community. So we need to continue to research, ask these questions, do the research, try to find answers, and really this is one of the many chronic issues that we need to try to find treatments for to improve the quality of life of people every day, because it does impact our society, it impacts our interactions with each other, it impacts our economics, everything. So it is vitally important, and I think we have a good program here, or good programs, and if you are interested, please call and sign up.
We talked about sometimes the times we live in can be challenging, and some days just there because you're like, dude, Scotty, beam me up, come on, man, where are you? But we don't have that choice, and instead what we have to deal with is the world we have, the world we're living in, and we really have to have a statement of fact, because facts usually are best derived from people who have knowledge, and the knowledge comes from experience and the fact that we've spent time studying a world and studying a topic, and we don't just have to be casually passing by and acting as if we're a font of wisdom. That's really not how it works, right? I mean, I'd like to say I make $100 million a year, and I go to the bank, and they're going to ask me for the facts, and so that isn't really how it works. When I started in medicine, it was 1986, was my first day of residency. If you had a heart attack, we gave you morphine, maybe a little nitroglycerin, and we let you have a heart attack. We had nothing else to do. And today, you may get out the next day because we put a stent in your heart, we got you back going, and you're going to live a long darn time. You know what that is? That's science. In my area of care, cystic fibrosis, when I started in medicine, the survival was 16 or 17 years. It was unusual to have an adult. And today, people born with CF may well have a normal life expectancy. That's science. When I started, if you had acute leukemia, it's like, don't buy a long playing record, right? You just don't. You're not going to live very long. And today, you live with. Diabetes has totally changed. Just think of all the diseases has so completely changed. And if we let the people who knew nothing about science work on that, where would we have gone? Where would we be today? But instead, we'd have science. And science helps us find things that can help us answer questions about why we may have to bear too much pain, emotional toil, or an early death. Places like Turning Point help that hope. Places like science help us live a lifetime that we otherwise would have lost. Faith is what we have to have in each other to help us get there. But you can't do it without all three, and you can't do it if you don't tell the truth. So remember, faith, hope, and science is the full answer to Beam Me Up, Scotty. All right, thanks again to everybody on our program. We'll see you next week.
He was asked to give some final words at a city council meeting, and they almost really were his final words. I'm Alexis Del Cid on the next All Things Heart. The Wichita State professor who wound up being the first of his kind here at the health system when it comes to heart transplants. Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.